The patient is a 2-year-old girl who presents at the ER room after falling from bed at 4:30 a.m. and landing on a glass nightshade was shattered on impact. Her mom checked her and found no bruises or bleeding. The next morning, the mom noticed her rubbing her right eye several times. She also keeps that eye closed by squinting all the time. She will not allow mom to look at the eye. Besides that, everything else is normal finding. Everything is a normal finding. Examination reveals this finding. A 30-year-old builder was using a hammer to hit a steel chisel. He felt something hit his eye, and the vision became blurred with slight pain and photophobia since 1 hour. He's fit and well, and there's no history of medical problems. On examination by his doctor, the vision was reduced to 6/12. A fluorescein staining lesion was seen on the cornea, but this appears Seidel's negative. A small hyphema was seen in the anterior chamber, and in the red reflex, it was observed with a direct ophthalmoscope. And there was a well-delineated lens opacity was seen as well. Examination shows the following finding. Alright, so regarding the case, we're looking at both cases together really, as related to trauma. So the first case, before we talk about it, the first case basically talks about a little girl falling into a candlestick, and you saw the picture. The picture gives you the immediate sign that this is a case of a ruptured globe. This is a diagnosis. A ruptured globe meaning basically the eye itself has been injured and it has been ruptured for whatever reason. Something is leaking out of it. And the surest sign, by far the surest sign that you can be sure of, even if you're not an ophthalmologist, that this is a ruptured globe is through uveal prolapse or uveal tissue prolapse. Basically, a part of the iris has been leaked out, like in the picture, and as a result, in the first picture, and as a result, this is the surest sign that there is a ruptured globe. Other signs of a ruptured globe could also include patient complaining of sudden visual loss and it becomes painful. Along with that, he'll have hypotony or decreased intraocular pressure because of the rupture of the eye, like a balloon. Also, a shallow anterior chamber. Also, collection of blood in the anterior chamber. They call it hyphema. And hyphema has its own problem. For example, if there's too much accumulation in the blood, in the case of hyphema as a complication of ruptured globe, then this can lead to corneal staining, staining of the complete cornea. And if that happens, then you have to do keratoplasty. You have to do surgery for it completely. That is a very big problem. Besides hyphema, there's also vitreous hemorrhage, hemorrhage within the vitreous humor. So these are all signs of ruptured globe. But the surest sign, such as mentioned in the first case, it was uveal tissue prolapse. Of course, there's no differential diagnosis. It's sure as it is. And regarding the investigation, well, typically, as a general practitioner, you stop examination, you put the patient in NPO diet, you cover the eye, you give him tetanus, and you refer him to an ophthalmologist. The ophthalmologist will come in, he will admit the patient to the ER, he will take a rapid history of the patient for what may be the cause of trauma, and then he'll do full ophthalmic examination. He'll look at the eye, everything about the eye, in and out. And then afterwards, he'll order for imaging, ocular X-ray and CT, to see what exactly is damaged in the eye and surrounding the eye. But he will never, ever, he will never, ever order MRI. MRI is a no-no, because let's say if there's a metallic, the cause of ruptured globe was a metallic foreign body. If you order MRI, it can pull the eye out. It's a big no-no. You'll always order, ultrasound, CT, ocular X-ray. Okay? Besides investigations, next is the treatment for a ruptured globe. The treatment for a ruptured globe is typically surgery. You have to do surgery immediately. But let's say in the case of uveal prolapse, if the patient came within 24 hours, you can basically relapse the uveal tissue back to its place by a spatula, okay, and give the patient topical antibiotics. But if the patient came more than 24 hours later, negligence, then in that case, you'll have to remove that piece of the iris and then suture the remaining part of the iris in so that you prevent severe infection by that point, okay? So that's pretty much it for the surgery and the treatment of uveal tissue prolapse, and really ruptured globes according to what's exactly been damaged. And then you treat the cause. For example, like hyphema, if you can, you can do surgical cleaning of the blood if you want, especially since another complication of hyphema is secondary glaucoma, if you want, okay? And that's pretty much it. Besides that, you have the second case. The second case, just to tell you that this is a case of intraocular foreign body. There's a foreign body placed, especially in the cornea. The most common site is really the vitreous humor. And this intraocular body can be could be metallic, could be anything. And you will do the exact same investigation and the treatment as we mentioned before, okay? But the one thing we need to keep in mind is if you have a foreign body deposition inside the eye, especially in the vitreous humor, then if left untreated, it can lead to what is known as sympathetic ophthalmitis. Basically, if there's a foreign body in this area right here, this can eventually lead to inflammatory cells to cause an autoimmune damage to the other eye. And this will affect the other eye as well. And it's a very, very bad complication that occurs following trauma, especially intraocular foreign body deposition, that we want to prevent completely as well. So that's pretty much it for the cases. And yeah, that's all she wrote.